Welcome to the Catalyst Podcast. I'm your host, Charles Epstein. With respect to Mr. Sly Stone, he of Sly and the Family Stone, today's podcast is a family affair. I will be speaking with three members of the Koehne family, all practicing dentists. Dr. Annie Koehne, graduate of Midwestern University College of Dental Medicine, Illinois, has been practicing at Chestnut Health Systems for just under 3 years. Her mom, Dr. Diane Metrick, is a University of Illinois College of Dentistry graduate with over 30 years experience in general dentistry and public health. And family patriarch Dr. Michael Koehne is a graduate of the University of Illinois College of Dentistry and has been a general dentist for 42 years. Dr. Michael Koehne treats all age groups. He practices and lives in Wheaton, Illinois. Welcome. Thanks so much for taking the time. Really do appreciate this.
Thanks for having us.
Yes, thank you.
My pleasure. This is a precedent-setting podcast. This is the first All in the Family podcast we've done. So this is very exciting. So first question I have, as I was thinking about this, it occurred to me that musicianship is something that runs in families. I wasn't aware until this very podcast that it might also be true of dentistry. So I want to direct this to mom and dad. At what point did you realize that Annie was destined to follow in your footsteps?
That's an interesting question. She has been in the dental practice since she was 6 weeks old in a little basket. So she has been quite familiar with the field. We never thought she'd be a dentist until she announced it one day that was her goal.
At what age do you recall?
It's about 18, wasn't it, Annie?
Yeah, I think it was sometime in high school, late high school, yeah.
And your folks did nothing to dissuade you?
No, I was a stubborn kid, and, being the child of two dentists, you thought that my path would be pretty linear, but because I was a little stubborn, I wanted to do anything but be a dentist. And then I started to recognize the role that my parents had in the field, and I had a great appreciation for it. And so when I was older and a little bit more mature, I realized that they have a true impact in the community, and they made a lot of positive change, and I wanted to follow in their footsteps. They really paved the way for me.
Yeah, it's as a parent, it's funny how that happens. Your kid eventually, at some point, or at least you hope, they come around. Let me ask you a question, because I think a lot of people, when they think of dentistry, they think about this, or at least some do. And I thought for years it might be a little bit of a myth, but apparently not. Research indicates that roughly 13 to 42% of dental professionals experience symptoms of depression compared to the general population baseline of under 4%. Why is that, Michael?
Well, when a patient a day walks in and tells you they hate you, it may start to affect some individuals, but it's
is that a literal thing, or you being?
Yeah, no. They walk in, they sit down, and they say, I really hate you, and they don't hate the person sitting in the chair next to them. They hate the whole concept and maybe their experiences that they've had. They've had a bad experience in a dental office, and it's just very hard for them to get back and sit down and relax. And they're trying to set the tone that they're uneasy. And so they start off saying, well, hey, I'm not comfortable here. And they say, I hate you. And, it can get to some people. So, but Diane's got some things to weigh in on that too. She's got different feelings too.
Yeah, I'm curious.
It's a very high pressure environment. Sometimes you're working in a very small space, tiny mouths, and anxious patients, which adds to strain. But the patients don't, obviously, their patients come to us and they don't hate us. It's, they hate the closeness, the personal, the invasion of their personal space, and anticipate discomfort.
Mm.
So, I dealt mostly with children, and children are apprehensive of strangers. So there are a lot of things to consider.
How do you deal with that?
Well, it is hard to deal with the professional isolation if you're working alone, and there are long hours and the business side of things. So You have to have outside interests, and you can network with other professionals, and that's quite helpful.
I'd like to piggyback off of that. I think being a newer grad and being the only provider here at Chestnut, it felt a little bit isolating at some times. So I really leaned on my fellow colleagues, whether they were other general dentists or specialists. And I think I didn't feel so lonely and I didn't feel isolated. And I found a lot of comfort that some of the problems and issues I was dealing with, I wasn't alone. So I was able to communicate my feelings and the situation with my other colleagues, and it made me feel better that we were all in a very similar position and we were kind of in it together.
Interesting. Annie, I want to come back to you. Some questions, just a couple things I want to ask your folks, Diane and Michael, in part because they've been in the field longer, and some of these questions has to do with sort of that perspective. Do you find that people have a better understanding today than at any point in the past about the connection between oral health and overall health, Michael?
Yes, there's a lot more education going on. I think that's the key, is educating people and connecting the dots. Our physicians are starting to recognize the connection as well. So, but yes, I think today there's a higher dental IQ is the way I like to refer to it, than there
Dental
was
IQ.
back in the 60s and 70s and 80s.
Now, Diane, I kind of want to ask you a related question. How does lack of access to dental care show up in other areas of health, like chronic disease, mental health, or emergency care?
A lot of chronic dental decay can be a chronic disease, but it impacts heart health, diabetes, pregnancy outcomes. So we have a lot of research now that oral health does impact overall health.
Why has oral health historically been siloed from primary care? And do you see that changing at any time in the near future?
Historically, dentistry and medicine evolved separately with different education, insurance structures, and care delivery models. And that's why they kind of diverged, but now they're diverging back. And we're starting to see changes with more integration and collaboration based on whole person health. We're just not teeth floating out in space. We are teeth attached to a body.
Exactly. Well, it goes to the previous couple questions. Clearly, there's that connection. It just seems on the business and on the insurance end, there's still a disconnect. So hopefully at some point those things are brought together, because it seems to me to make perfect sense. Annie, you've been with Chestnut for 3 years. If you would tell our listeners about your role and your work there.
Yeah, absolutely. So I came on at Chestnut right when I graduated dental school, and it was just a building. We didn't have a whole dental clinic yet. It was still under construction. So for about the first 9 to 10 months, we were actually organizing the inside, getting policies and procedures. And in 2024, we opened up to the public, and we've been seeing patients 5 days a week ever since. And it's been absolutely amazing, but we have definitely felt the demand of need in this community.
Let me ask you, what makes a federally qualified health center, an FQHC, uniquely positioned to address dental disparities?
Absolutely. So I think one of the key factors is that FQHCs, we provide care regardless of the patient's ability to pay. So here at Chestnut, we use something called a sliding fee scale, and it's based on the patient's income and family size. We also integrate dental, medical, and behavioral health services in one setting for more holistic, comprehensive care. And I think another key point to add is we are physically located in a high need community. So that helps improve access for populations who face geographic and socioeconomic barriers.
Is there any obviously in the last handful of years, the emergence of telehealth has made it easier to access care that would otherwise be difficult to access. But I'm not sure that dental care can be administered virtually. Is there any technologies that have emerged in the last handful of years that have lowered those barriers, or anything on the horizon that you can think of or know about?
So I know that there is a push for some telehealth dentistry, but of course, telehealth has its limitations. I think one of the key things to note are mobile units or mobile dentistry programs. So instead of the patients coming to us, we're eliminating the transportation option, which is a barrier to care. And mobile units go to meet the patients where they're at, whether it's a school, residential facility, nursing home, stuff like that.
Michael, Dan, I want to come back to you. What are some challenges private practices face when trying to serve Medicaid or underserved populations?
Well, there's lower reimbursement rates, and there is some administrative complexity that can make it financially tough. And sometimes, due to the patient population, they have challenges and regarding missed appointments and higher treatment needs, such as they don't have transportation, which makes it challenging.
Michael, any thoughts on that?
Well, it's also hard. We don't have as many staff members. It's hard to recruit assistants, receptionists, and hygienists. And so the limited number of hands and auxiliaries, we just don't have the ability to see the patients as we'd like. The vast majority of it seems to be the reimbursement, though, I think is a big thing.
How about collaborating with public health systems or community organizations, do some outreach, raise awareness, and maybe bring some people in who otherwise would be beyond the reach of these services?
We work with various nonprofits and social agencies to assist individuals in need, such as like Head Start, how we can collaborate with community and public health systems. Of course, we can volunteer and do school screenings, the back to school fair, nonprofits, and expand reach through many social services.
So much of it, I think the easiest way for us to reach people is to provide, education and to let them know what resources are truly out there and where to get those resources. If we're not providing them all ourselves, letting them know about, free or low cost programs, where they're located, what's available, what benefits they may be able to apply for. Sometimes there are places that'll give grants to veterans or something along those lines. People just don't know they're there. So giving education is tantamount to getting people to seek out care.
I asked Annie about any technologies that may fill some gaps, anything emerging on the horizon. So let me ask you, are there any trends that you can point to, whether it's technology or workforce models, even policy shifts that you think will have the most impact in dental health in the next several years, 3 years, 5 years, 10 years?
I think we'll see expanded workforce roles to assist in treating more diverse populations. And as far as looking to the future, in 10 years, technology is racing ahead. And I think prevention, hopefully, we've made a lot of progress in the areas of prevention, and I think that will continue.
By the way, is there any mind-blowing new dental technology that is going to be coming down the pike anytime soon?
Well, I wish I knew, but the world is open to many fascinating things. Who would have thought we'd be able to carry a phone in your hand, which is essentially a computer? But teledentistry may be expanding in ways we haven't even imagined. AI in diagnostics. It's 3D printing.
Mm.
So it used to take a couple weeks to get a crown, and now because of CAD/CAM, which is computer
Aided design and machining.
that
It's a lot of it's digital dentistry now as opposed to analogs, where we used to fill an impression tray full of material and put it in your mouth and it would sit for X number of minutes and in set. We now can use a intraoral scanner and capture the same or even better information instantaneously, and then provide that either to a laboratory or to a program that will allow us to fabricate all types of appliances with 3D printing, The materials are expanding, becoming better, becoming less expensive, becoming more versatile. That I can see happening very soon. And it's again, it's making it easier and more convenient for the patients in the long run. We can communicate better. We can take a scan of a jaw and allow the patients to actually see.
Maybe even robotics.
Mm, there you go. There you go. So, but it doesn't sound, a lot of people in different professions, white collar, blue collar, concerned with AI. It's going to make their jobs more difficult. It's going to take over a lot of jobs. Apart from robotics, which is probably down the road a piece. I don't imagine dentists are spending sleepless nights wondering about how AI is going to encroach on your ability to do your work.
Oh, the dentist is always in charge. Any healthcare physician, provider, they're the definitive because they have the experience and the knowledge. AI cannot replace a physician or a dentist at this point, or
Yeah.
any point really, I think.
Yeah, because I was talking to somebody the other day who years ago was working on a project that had to do with some medical data in another language, and it involved translating that sort of in real time to other languages. And he said the difficulty is that some of the nomenclature is really not easily translatable, and in the medical field, there's no margin for error.
Right.
No.
You can't do. What about remote? I mean, Annie mentioned telehealth as it applies to dentistry. It's obviously not there. Can you see, I suppose I can imagine a future where you can do diagnostics virtually, maybe even, I don't know, do x-rays remotely. Is that a plausible future?
Yes, telehealth, teledentistry is growing, and there's remote monitoring. Uh, it's asynchronous, synchronous. You can talk to, like we're doing, in real time, and or in some remote areas, a healthcare provider can collect diagnostic information from the patient and send it to a healthcare provider who will then provide a treatment plan and be able to provide access to remote areas where there may not be a local provider.
Annie, let me ask you, if listeners could take one action to improve oral health in their own communities, what would it be?
Yeah, absolutely. So I think prioritizing prevention is key, and prevention starts with education. Education is the foundation. And so I would just say promote daily oral hygiene habits and especially regular checkups. I feel like a narrative that we hear all too often is I only go to the dentist when it hurts. Well, let's see you a little bit more often so you don't get to a place where you just come see us when you have pain or discomfort. So I think just educating on routine checks and also just establishing a dental home so they're not trying to call all these offices, trying to get in somewhere. I think building that rapport and trust will help with the patient experience and will make the dental office a little bit more inviting for the patient as well.
Couple of closing questions, and I want to put this to the three of you. Sort of a coda to our conversation, because at the outset I asked about, the high rates of depression that dentists may be susceptible to. What keeps you motivated in this work, especially when some of the challenges feel so systemic?
Well, what keeps me going is relieving pain, restoring smiles. It really adds up. You can make a difference in people's lives.
That's a good, succinct answer. Michael?
I've been a dentist for quite a while, and I've built these great relationships with people that I can talk to them. I enjoy going to work. It's you're meeting friends and family members because you've had this relationship that you've built over the years. And then we had talked about people who are very phobic, and being able to take those folks and talk and discuss, and most importantly, listen to why they're phobic and get them to be less fearful. I see that as a huge accomplishment, is having them come in a year from now and they're, they're not happy to be there, but they didn't lose a night's sleep because they had a dental appointment. And to me, that's a big plus. And it motivates me. I'm obviously making some positive changes in their lives. So
yeah, no, that's great. Annie, let me ask you a little bit of a different version of that question. What would you say to the 18-year-old version of yourself who was considering going down this path? What would you say to young Annie?
Oh boy, how much time do we have? Because I think I have a lot of advice. I would honestly say give yourself grace. You know, those baby steps are huge accomplishments, whether it's personally or professionally. I think 18-year-old Annie was very anxious and very stressed. And, at the end of the day, everything's going to be okay. And that's a mantra I kind of bring to my patients as well. So it's something that I had to stumble and learn along the way. And I had great role models, my mom and my dad, to be on the other end of some of those phone calls when I would call them very stressed. But I would honestly tell myself, give yourself some grace. At the end of the day, everything is going to be okay. And it has always ended up all right as well. So, yeah.
This whole conversation is leading up to this one last question. And I'm going to ask this of all three of you. If I use a water pick, why do I also have to floss?
Well, I'll answer that first.
Please.
So how I explain it to my patients is if you have a knife with peanut butter on it, if you just run it underwater, only half of the peanut butter comes off. That's why you have to grab the sponge and then manually remove the rest of the peanut butter. It's a similar concept with the water pick. The water pick takes away some of that food and that debris, but you still need to go in with a physical floss to remove the leftovers, any other food or bacteria or anything that's hiding out in between the teeth.
Anything to add to that, Michael, Diane, or is that pretty much the answer?
That is the answer.
But, as long as you're doing something, though, that's the big thing, is doing something other than just brushing. If you're taking that activity.
There are a lot of different products on the market that can help you clean in between teeth.
Okay. Well, Jan, thank you very much for that. I was eager to get the definitive answer, and that seems to be the definitive answer. So thank you so much. But kidding aside, I really do appreciate the three of you coming on. And as I said, this is a precedent-setting podcast. I get to speak to three members of the same family, all practicing dentists. So to the Koehne family, thank you so much.
Thank you.
Thank you for having us.
Oh, my pleasure. This is Charles Epstein for the Catalyst Podcast. Thanks for listening.